Well, good morning. It's a real pleasure to be here today, and thank you very much for the invitation. I'm going to be talking about mental health and psychological interventions, so a bit of a current review of what's out there, since mental health and psychology and psychiatry has always been linked in terms of support, treatment and input. So what is out there? So I decided to just do a bit of a current review. So yes, the old asylums, which was so-called treatment, and the treatment consisted of medication and routinized exercise, and it catered for all mental health. So you will have people from suffering from simple depression to acute psychotic episodes, everyone stuck together in an asylum, which will just live there. And thankfully we have moved a long way from it. So there is a lot of guidance in our days. We move a long way and things have moved on, but there is a lot of guidance out there. Guidance to support mental health and the right things to do in psychology to support mental health. But we are in the 21st century, and what is out there? What interventions? What are the best ways to support someone who presents with a mental health problem, which can be anyone? The statistics currently is 1 in 4. We're now looking into 1 in 3, and can be absolutely anyone. It's not them, us, everyone. It can be me, it can be you, it can be anyone, and it's important for us to remember that. So guidance, there is a lot of guidance. The Cochrane Centre, which is an independent, not-for-profit, not government, volunteers for medical research, do absolutely amazing work, and they're looking into evidence-based medicine, from biomarkers of antibiotics to mental health, and we can trust the information that they give us. And they're always looking into evidence-based, and they bring us information about this is the right interventions for mental health. And they are so, I have to say, the work is so amazing. They're so out there. They will look into things such as, if there's an invisible unicorn that's been grazing in my office, can you just prove me wrong? And they're wanting to do these pieces of research to be actually talking about mental health, talking about evidence-based, talking about what can we do to best support. There's guidance as well, of course, from the GPs, the Royal College of GPs, and the GPs now are more focused in mental health because they have the key to all services. All services now come from your GP. So if you feel that you are having some sort of difficulties, do contact your GP. And if your GP just decides to prescribe you medication, say no, because you have a right to request psychological interventions. You have a right to request alternative therapies which are out there. It should not just be medication and that's it. And the GPs are getting more and more information now provided by other services to learn how to deal with mental health. And of course, there's the good British Psychology Society, which is brilliant and dishing out guidance and more guidance and more guidance and good practice. A bit like a school dinner lady. It would just provides guidance and guidance and guidance. But where is this going? Is anyone reading that information? And then more guidance. Of course, there's the desserts. There's more guidance provided and provided and provided. Another body that we have, there's so many bodies in mental health. Another body that we have, of course, is the NICE Institute. The NICE Institute talks about, it's a National Institute for Health, so it's not just mental health, but it talks about all illnesses and diseases, and in there you'll find good evidence-based information. So if you're feeling depressed, you go into the NICE website and it will tell you this is what should be done, this is the support that you should be getting. So do contact your GP. And of course, I have to speak about my colleagues, psychiatry, the Royal College of Psychiatrists, who do a lot of work as well. And you have more guidance, and you have NHS, of course, the NHS website, which provides a lot of information. And there is a lot of information as well. Mind, which is a great charity that I take my hat off to the work that they do. And other excellent charities, as I know some of them are here today, so thank you very much for coming as well. I really take my hats off to you for the great work that you do. And they do all the groundwork. They really support people. And of course, there's also guidance everywhere else in the internet. Like my colleague said, you look in the internet, you'll find the strangest and weirdest guidance. I do not recommend, please look at the previous websites. Do not take your Facebook advice as rule, as a clinical advice, okay? So in theory, mental health problems should definitely get the VIP treatment because there's so much guidance, there's so much support out there, but the reality is, it's not really like that currently. You have a plan, you have an idea, and you want to get support, but when you want to get that support, you're just faced with more and more difficulties. You just might feel like, actually, I shouldn't be really looking into this. It's nothing. This will go away. It's nothing. Well, I went to the GP, it just gave me this medication, so it's nothing. It will go away. It doesn't go away. And there's support out there. So when you're faced with any of these so-called labels, what do you do when you're faced with these difficulties? Just go and get some guidance. What is out there? And where to turn, and really what helps out there. I just put a graph in there because I think graphs look good in presentations. It doesn't mean anything. I just put it because people like to see graphs in presentations. So what to do? I remember when I started work in this country, I started working in children's services camps, so-called camps, and one of my colleague psychiatrists said something like this to me. And said, well, most of the kids that present in here are not mad enough to access the services, or other ones are just too mad, so we can't do anything. And then there's a very small percentage that come to our services, they are just the right mad. But the ones who are just the right mad, we still have a waiting list for 18 months. So when they come in, just do all the assessments and then let them know that they have a 18 months waiting list. So this is how it was, and as things evolved since then, I'm not sure if they have. For adults, what is out there? There's a big Facebook like in there because I really like that. Psychological therapies are now accessible in the NHS. So you can have access to psychological therapies in the NHS. The IAPT service and program, which is improving access to psychological therapies. The latest research from October 2016 informs us that provided over 1 million of people with access to psychological therapies, and research shows reduction in individual healthcare usage and use of long-term prescriptions. So it's a gain. Why are people not using, why is this not offered more and more access to psychological therapies? The NICE guidance as well provides information for each mental health problem based on latest research and evidence. So it's not like one size fits all, there are different information out there. So the BPS, of course, because likes to dish out information, decided to do a piece of work combined with NICE and improving access to psychological therapies in terms of clustering therapies with diagnosis. And I have to say it's a very good piece of work by these two colleagues. And they talk, this is just some of their clusters, they talk about what service should people be getting. So if someone presents to you with anxiety, they should be offered drug treatment, but also high-intensity psychological interventions. They should be provided with a manualized cognitive behavior therapy, and also 12 to 15 weekly sessions lasting up to an hour. So everything is out there, and we should be providing this information. We should be delivering these services. Unfortunately, there is a waiting list as well. So you go in to see your GP, the GP provides you, yes, you can access psychological therapies, and taking into account your presentation, I would recommend for you to attend 12 to 18 sessions of cognitive behavior therapy. But there is a waiting list of about 3 months, so until then just try and take your medication, you'll be all right. Unfortunately, this is what's happening. So there is a lot of therapies. I'm not just talking about cognitive behavior therapy, but there's also, makes me think about the dodo conundrum. Don't know if you have heard of it. It's something very talked in psychologists. You know, what is the effect of psychotherapy, all psychotherapies produce equal outcomes. Not necessarily, but good therapy alliance with someone, non-judgmental, for you to talk to, building rapport, guidance and support, they are pillars to the recovery process. And I think we all agree with that. If we have access to that, that will make us improve, that will make us feel supported. And it's really important that people have that access. Suicide currently is the leading cause of death in England and Wales for men under 50. The stigma with men, with sports and achievement, and we have a great charity here today, Boys Don't Cry. And when you look into that information, it makes you think, what can we do more? Something needs to be done. It's shocking to think that, and you have some figures here from the Samaritans, the highest rate of suicide between the male age between 30 and 44, suicide in this group accounts for more deaths than road accidents, murder, HIV/AIDS combined. So it's the biggest killer of young men is suicide. It's nothing else, it's suicide. So what is the answer? The answer currently is budget cuts. The answer is rely on great work by the charities. So where's that conversation that Kel was just having about mental health in parity with physical health? Where is it? More needs to happen. Currently, we're talking about October 2016, 50% of people have to wait more than 3 months after an assessment to receive their first therapy session. So it's not all doom and gloom, I have to say. So We Need to Talk Wales is an initiative that just came out last week about a new coalition of charities, including the British Psychological Society, putting pressure for patients in Wales to have better access to psychological therapies. The report in October 2016, launched by Ministry for Social Services and Health, Rebecca Evans, which is an Assembly member, informs that people of all ages should have access to psychological therapies within 28 days. People should make an informed choice about a full range of evidence-based psychological therapies, not just accept what is offered to them. They will be able to have a full choice of psychological therapies offered to them. And this is, I think, one of the first countries to do that is Wales with this report. There's a lot of investment by the Welsh Government. The Wales Psychological Therapies for Adults Mental Health Plan, which is now easily accessible on the internet. I do recommend for people to look, because this is the guidance from your government. So as a conclusion, there's a lot of investment in better access to psychological therapies, IAP services, a lot of investment in evidence-based therapies, NICE, Royal College of Psychiatry, a lot of investment in training workforce, such as improving access to psychological therapies, British Psychological Society, investment in new computerized technology and therapy, so new ideas such as computerized cognitive behavior therapy, which is we're doing some tests at the moment, it's starting to come up quite well in terms for anxiety disorders, in terms of using gradual exposure with, I can't remember the name of the goggles that they are using, but it's all about putting new computerized technology. Also Skype therapy, but we are a long way to beat the stigma, to provide immediate support when it's needed and to respond to the needs proactively. So all this work can be done starting here with you. There's some references and articles for further reading, and thank you. Thank you very much.